Hey, everybody, welcome. This is Dr. Levi with your show, The Dr. Levi Show. The show is about you, education, empowerment, and uplifting. That's what our show is about. So glad to have you with us today. Today is an unusual show. It's one of my favorite types of shows, actually, because I have a chance to really interact and interface with you, our viewers, our listeners, our subscribers to YouTube. Speaking of YouTube, right now we have over 2.2 million views, which is fantastic. Our goal, of course, is 100 million, so we're on our way there. I feel real good about that. So wherever you are today, I hope you're having a great day. I feel really wonderful. It's a spectacular day here in Los Angeles, a little bit breezy, but overall just beautiful as usual. I always think that being here in LA is like living in paradise. It's so spectacular most of the time. It really is. Now, before I get started, I like to say that, this show, we really send out our condolences to the families and to the nation, really, I should say, of all the people that are in Belgium right now and in Brussels who are really suffering from the terrorist attacks there. We feel really badly for you all. But I want you to know here at the Dr. Levi Show, we stand in solidarity with you, knowing that justice will prevail. We're sorry that this happened. And we're just hoping and knowing that you'll have the strength to get through this. And I believe you will. So I just want everyone to know that, send out your thoughts, prayers, and good vibes over to Belgium and all the UK, which is really in a state of hold by terrorism in so many ways. So just know that our thoughts are with you. Now, for our show today, I want everyone to know, too, that we have a big summer camp coming up in July. It's an idea that I had last year, and I shared it with my team, and we said, hey, yes, it's a great idea. We're going to do it. So the summer camp will be about healthy eating and healthy living and exercise for children and underserved populations here in Los Angeles. So I'm really excited about that. It's right now, the working title is the Heart Healthy Fun Fitness Camp. So I'm just excited about it because I think it'll give everyone an opportunity to really come together as a community to get healthy, to understand the joy of cooking properly, how to choose vegetables properly, how to cook them, clean them. It's going to be just a great, great time. And, of course, I will go over exercises with the families that are there. Why exercise is important, how to do it properly, why it's preventive with respect to if you exercise, you'll decrease your risk for high blood pressure, cardiovascular disease, as well as stroke and different forms of cancer. So I'm excited about sharing all this knowledge with the community that really needs it. So it's really wonderful this summer. So I'm looking forward to that. And later this year, we also have projects that I'm working on with some gamers devices that I'm actually developing, ideas that I have that I think will help the gaming community and actually anybody who does a lot of repetitive motion. The goal with the device that I'm designing is to decrease or prevent repetitive stress injuries. So I'm hoping that by the goal here is to get this on the market maybe by, if not this year, later next year. So I'm really happy and excited about that. So with that said, today is Question and Answer Day with Dr. Levi on the Dr. Levi Show. So let me tell you a few things here. The answer that I'm going to give you, I want to remind you, you have to definitely talk to your own healthcare provider. These are suggestions that I'm giving you and sharing with you from my font of knowledge, but I want to remind you that you have to interface and talk with your own provider in your healthcare affiliate, really, because a lot of the questions are from India and Bangladesh and Saudi Arabia, Egypt, from all over the world. We're grateful for the questions, but again, I'm not physically seeing you. I'm not examining you. I'm not looking at your MRI, your x-rays, your ultrasound, your EMG, your nerve conduction studies, your blood work. I'm not physically touching you to make sure that on exam I feel what you're telling me that you feel. So with that said, be sure to consult with your own healthcare provider so that, what I'm saying you can add as an adjunct and tell them that, hey, Dr. Levi said this is what he was thinking, but you have to have your healthcare provider see you and examine you. All right? So with that said, I want to go over for the next hour as many questions as I can. I'll tell you the person's name. Some of them, they prefer to not say their name. And then some had names that were I don't know if they'd really be appropriate for me to, their handles, I should say, or their aliases were somewhat interesting. I don't know if I really want to repeat those, but most of them I will. So let's get to our first question. All right. So this says is someone whose name was somewhat inappropriate, I think, to say on the show. But it says, Dr. Levi, just a concern regarding the wear and tear of the tendons. As a musician, I've been trained to avoid flexion of my joints or compressing the object with a fist to avoid tendonitis. I created a routine to strengthen my wrists, fingers, and forearm by using isometric exercises that do not require flexion, with incorporation of stretching exercises. Just what I want to know is, will my tendons be okay with prolonged use of exercises like wrist curls or finger extensions? Thanks, Dr. Levi. So, thanks for your question. So let's just say this: your tendons and your ligaments, they can go for a long, long time. Really, they're meant to survive. They're meant to be used, and if you exercise properly, you won't have an issue. However, like anything, if you over-exercise, if you're not aware of the stretching exercise like we talked about for your wrists, for your fingers, for your forearms, for your elbows and shoulders, as well as your neck and posture, you're going to have issues. So first thing I want to tell you, always be aware of your posture. Secondly, be clear that the exercises that I have on YouTube for stretching your wrists, fingers, forearm, and shoulders and elbow, all of these exercises can be done daily. They're simple stretches. They'll take about 10 to 15 minutes. More importantly, be aware of your posture. Even when you're at work, be aware, are you sitting upright? Are your shoulders squared? Are you sitting with your chin up? Are you sitting crouched over? All of these things affect the rest of your body. So posture is very, very important. Posture alignment is important. So with respect to your wrist and your tendons and your ligaments, your tendons and ligaments will be fine. Do the stretches like I've talked about. And of course, more importantly, monitor how much screen time you're having, as well as if you're a musician, then how much you're playing. You know, if you're playing 12, 14 hours a day, well, you may have to cut back to 6 to 8 hours a day. Not all the time, but maybe for a week to give your body a break. The goal, one word I want to give you that I think is so important and so imperative for life, really, is moderation. Everything in moderation. There's really no bad in life, you know, but you can overdo it. That's from overeating to overreading to over-texting. All of these things, it's an issue if you overdo it. Moderation is the key. So thank you for your question. The next question is from Ben. He says, hey, I love to hear some exercise and stretches for sore forearms. I play guitar too much and my forearms are really falling apart. It would be great to get some advice on how to prevent and treat swollen and inflamed forearm flexors and extensors. Thanks, Dr. Levi. Okay, Ben, well, thanks for your question. Basic stretches for the forearm, the ones that I love the most, are the inertial exercise, and I've shown those before. I'm going to back up from the screen a little bit, and I want to show these to you. The inertial exercise are the exercise I talked about before, whereby you can keep your arm straight, you bend your wrist, and you hold your wrist down this way with the elbow straight, and you hold this for 30 seconds. And you're going to feel the stretch through your forearm. You're definitely going to feel that. You hold, you're stretching your extensor carpi radialis longus and brevis, as well as the extensor mechanism of your wrist and your forearms. So hold in this position straight, then hold that for 30 seconds. Then bring your hand up. Again, elbow straight. For every forearm stretch, the elbow is always straight. Keep your hand up, and then just bend your fingers and palm backward. And you hold this position again for 30 seconds. Let me do it from this arm, like this, and hold back for 30 seconds. The goal here, of course, is to keep the elbow straight. And you will feel this. No matter what job you're doing, it's so important to do that stretch because it's so helpful. Now, other things that you can do is simply to massage with your thumb this area. So this is the lateral epicondyle. So put your finger right by that area and just in a rotating motion, circular, around and back. Now, I would do that maybe 15 to 30 seconds. Do it right at the elbow. Do it in the midsection of the elbow, the same thing. And then do it right at the wrist. Those areas are prone to having just a lot of pain often, especially if you're a musician, depending on which side you pick with and use the chords with. So it's important as a guitarist that you really do those stretches. Another thing I can share with you that will help you too is to ice your forearms before and after you're playing, because that will help you tremendously. It really, really will. So, Ben, I hope that helps you. If you have more questions, of course, please let me know. And of course, the other modality that I love for musicians that I take care of is I always recommend this, and that is acupuncture. Acupuncture is a great uh, it's a great modality of healing that many people don't use, and it's unfortunate because it's very efficacious, very effective. Now, next question is from Shakir. Hi, doctor. Thanks for the time. I want to ask you about foods that help me to gain muscle mass. I use dairy products, yogurt, cheese, butter, and some other proteins, but I don't want to have fat on my belly, for I'm aiming to tone my abs and have a six pack. Should I stop consuming dairy products? Okay, Shakir, thanks for your question. So let's go over a few things about dairy. I'm not a big fan of dairy. I never have been. So I think dairy is such a pro-inflammatory food that the downside of it outweighed to me the upswing of dairy. So I'm not big on dairy. Now, if you want to drink other types of milk like almond milk or cashew milk, I'm okay with those. But in general, I'm not a fan of soy milk. I'm definitely not a fan of regular dairy, even low fat or 2%. I never have been. Now, as far as gaining weight when you're exercising and working out, well, what you can do are the following. One, remember that you can get protein from the following. You can have lentils in your diet. Lentils, either green or orange or red lentils, are a great source of protein for your diet. Also, if you want to have a protein shake, you can have a protein shake. However, I recommend that you have a protein shake that's not wheat-based, that's not soy-based, that has no sugar or dye in it. Now, those can be hard to find, but if you go to your Whole Foods Market or maybe a GNC, I'm sure you can find something that works for you. But again, I would stay away from things that have dairy in it, that have things like sugar and wheat and different types of preservatives, a lot of dyes. Those things, how could that be good for your muscles? You know, in general, when it comes to diet, the things I always recommend to stay away from are the following. One, dairy, soy, sugar, salt, gluten, minimize wheat, of course, and of course, alcohol. Those are the things I can share with you. You know, the key with fitness, of course, fitness is a lifestyle. It's very easy to get a six pack. I can teach that. A six pack is easy. The key is, can you maintain it? How do you maintain a six pack? Getting it, no problem, but can you keep it? So I really appreciate this question. But if you do eat a lot of yogurt, cheese, and butter, you know, that's not the ticket. And if you really want a six pack is not really based on protein. It's more based on aerobic activity. So if you want a six pack, we all have six packs by definition in general. So the key is, can you see it? So you have multiple layers of adipose tissue, i.e. fat tissue over there, then you can't see a well-defined six-pack. So a six-pack is not difficult to get, but you do want to do more aerobic activity. So if you want a six-pack, you want the eight-pack, you want well-defined core muscles, then it's so important to do the aerobic activity. And I recommend doing aerobics for 30 to 45 minutes every day. I don't recommend taking one day off from doing aerobic activity. And the key from that is to diversify the workout. You want to run, you want to jog, you want to hike, you want to do things that are very different. Don't simply go in the gym, do the same Stairmaster, the same stair climber, the same elliptical trainer, the same rowing machine. No, you want to mix things up and do something different. So once you hit that goal after 2 or 3 weeks of where you want to go on the elliptical trainer, well, great. Switch up to go to the rowing machine. When you reach that goal, great. Go to the recumbent bike. When you reach that, great. Go to stationary bike. Go to the treadmill. Do different things, and that'll get you the six-pack. So, Shakir, thanks for your question. The next one is from Honey Bun. I love that because that has a lot of significance, that name, Honey Bun. So let's go through this. So the question from Honey Bun is, hey, Dr. Levi, I've been getting these weird episodes of pain and stiffness in the right side of my neck. Last time it didn't last very long, but the one I'm having right now as I'm writing this has been lasting for over 24 hours now. I'm starting to be a bit worried. Could this come from sitting too much or playing video games or from sleeping in the wrong position? Thanks a lot for your work. I really appreciate it, Dr. Levi. Okay, well, Honey Bun, let's go over a few things with you. So the number one issue here may be simply posture. Posture alignment, as I talked about earlier, is so important that when you're playing video games, when you're at the computer, that you sit with your chest up, your head is up. Make sure that the screen is properly adjusted from your face, no more than an arm reach away. Make sure that the monitor is adjusted properly so you don't have to look down or look up. You can look straight into the monitor. Third, look at how you're sleeping at night. You know, we don't know how we sleep, but one thing I always suggest is a cervical pillow. A cervical pillow can simply help you tremendously if you've had trauma to your neck or head before, or if you have difficulty sleeping, or if you wake up every day with quote unquote a crook in your neck or pain in your neck or a form of torticollis, which means that you have tightening of one side of the muscles on your neck, the platysmus as well as trapezius. So with that said, I recommend a cervical pillow. That may help you tremendously. Now, with respect to video gaming, if you're gaming a lot, well, you have to look at how your posture is. Are you hunched over the console? Or are you hunched over the keyboard? Are you trying to play? I even know someone recently who told me that they're having pain in their neck because they're playing video games at night, but they're playing with the monitor. They're holding the monitor up and laying flats as in a sleeping position, but holding the monitor up at night and bending his neck forward like this one, having a lot of neck pain. So you have to look at things that you're doing from what I call a what makes sense for your body. Be aware of your body. And because you're with your body, you're in your body, you know your body. So if something doesn't feel great, then change it. Make the postural adjustment to align your body properly. All right. The other thing I was going to share with you is you can go to the YouTube channel that I have, and there are exercises there to strengthen your shoulder girdle muscles, your rotator cuff, as well as neck muscles, and that will help you also. Because so often people, if they're at a monitor, if they're playing video games, I'm gonna do this from the side. They will actually play like this. They will do this. It will hunch forward like this, or they'll look down. They'll look down this way. So it's so important to keep your head up like this. Your head is up. Your shoulders are up. Your head and shoulders are up, and you're not crouched down this way and not looking down. All of those things will affect your neck muscles, your posture in general. Posture is so very, very important. It really, really is. Okay, so Honey Bun, I hope that helps you. But yes, it could be from playing video games. If you're having that funny feel on the right side of your neck, I would still say consult with your doctor, because I don't know how old you are, of course. But even things like coronary artery disease and having a myocardial infarction or a heart attack, some of those symptoms can be right-sided sometimes or left-sided, depending on the person. So often we say in medicine that if someone's having chest pain, that's mainly on the left side, and the pain is radiating to their jaw or down their arm, then most likely it's a heart attack. However, everybody's body doesn't read the book about that. So your body may say, hey, I'm having a heart attack, I'm having pain on the left side. Or women, for example, women who are having heart attacks sometimes don't have any chest pain at all. They may have abdominal pain. They may have back pain. They may have a feeling of indigestion. They may have a feeling of, quote unquote, impending doom. They have a very severe headache. So I want to say this, when it comes to a myocardial infarction, a heart disease also, men and women can present very differently. So if you're having these types of pain, I would still say, Honey Bun, make sure that you go and get tested and be seen by your doctor. I hope that's available for you. All right, so I hope this helps you. All right, next question is from Ale. This is ALLES. How many times a week should I train my abs for optimal results? A lot of questions about abs. Since I've heard something about muscle confusion or muscle breakdown, the same question for chest, Dr. Levi. Okay, so ALLES, Ale, in French. Several things about that. So when it comes to training your abs, like any muscle, I don't recommend training any muscle every day. I recommend you have a day of rest. So you can train your abs 3 times a week or maybe 4 times a week maximum. And with that said, the same for your chest. But it's so important that you diversify the workout. When it comes to exercise diversification is sort of like financial portfolio diversification. So you don't want to have a financial portfolio, have everything in stocks or everything in bonds or everything in gold or everything in silver or everything in oil. You want to have a mixture of all of those. So it's the same with exercise. Exercising your abs as well as your chest, you want to diversify the workout. So meaning, don't do the same exercise for your chest 3 times a week. You want to modify that. So if you want something different to shake up your abs, I recommend the following. You can do 4 to 5 sets of 10 to 15 or whatever exercise that you choose, but do 3 different types of exercises on a Monday. do a different set on Wednesday, doing a different set on Friday, and then maybe Saturday or Sunday, do maybe a very intense aerobic workout those 2 days, but do aerobics every day. To get abs, again, I want to reiterate this to the highest mountain that I can shout from. Abs are really an issue of aerobic activity. If you work the fat off in front of the abdominal muscles, the rectus abdominis, you will be able to see them. If you don't do the aerobic activity, you're just not going to see them. No matter how many sit-ups you do, how many leg lifts you do, that's not the ticket. It's really being proactive about monitoring your diet, but more importantly about diversifying your workout. But aerobics. That's where you get the abs, period. So I hope that helps you, Ali. Again, don't train them every day. Every other day, the same with chest, and make sure that you train all parts of the chest, upper and lower chest, as well as do flies, of course, for the internal aspect for the mid aspect of your chest. One other thing I want to add about ab training too is when you're training your abs, also make sure that you're training your serratus anterior as well as your intercostalis, your obliques, because that also gives you, quote unquote, that shredded look, it looks really, really tight on the side. All right, so that's important. So core exercises as well as aerobic activity, that's the ticket. All right, Salembo is our next question. How do I improve my forward neck posture, Dr. Levi? What exercise would you recommend? Okay, Salembo, and it's Salimbo. I recommend the following. One is you can simply sit in this position, roll your shoulders back, roll your shoulders forward, and do a set of 15, 3 sets of 15. Then you can do shrugs up and down, a set of 15, just like that. Then you can bend your neck to the side and hold that for 15 to 30 seconds. To the other side, hold that for 15 to 30 seconds, and then forward for 15 to 30 seconds. The goal with these neck rotation exercises are the following. Hold the position for at least 30 seconds. Also, when you do an exercise for your neck like this, it's so imperative that you do these sitting down. For example, if you get sort of dizzy or lightheaded, you don't have to try to sit down or your body just pass out because it makes you want to sit down because of an orthostatic issue. You want to simply do them in a seated position. It's easier, I should say, and it's also it's safer, I believe. So for forward neck posture, be aware of sitting properly, not leaning forward, not crunching down, not chest down like that. You really want to keep your chin up, your head up, shoulders squared. Posture is so very important. Now, the next question is from Ghost Who Walks. So the question is, when you get the time, if possible, could you do a response about VMO? I was diagnosed with a misaligned kneecap for a few months back, and despite doing the exercise suggested, so far there's been little improvement. I'd love to see your suggestions, Dr. Levi, on ways to improve the pain from that issue. Thanks for your time. Okay, Ghost Who Walks, I appreciate the question. The VMO stands for vastus medialis obliquus, which are the muscles on the medial aspect or inside aspect of the thigh. And if you exercise them properly, they can realign the patella so that the patella doesn't go too far laterally, which can cause subluxation as well as dislocation of the patella, as well as a feeling of instability when you walk, or more importantly, when you run or go up and down stairs. So if you're not having any pain relief from the vastus medialis obliquus exercise, you have to talk to your doctor to see if you've developed what's called patella tendonitis. It's very, very, very common to have that associated with someone who has misaligned patella. So I recommend, again, Ghost Who Walks, getting a check by your doctor to see if you have a patella tendonitis or maybe quadriceps tendonitis. And more importantly, continue to do the VMO exercises as they suggested. But if you're having pain during those exercises, or if there's not a decrease in the pain, then we have an issue here. So you have to go and talk to your doctor and make sure that you're on the same track with them. Maybe you're not doing the exercises properly. Maybe you're overdoing the exercises. Or maybe there are other exercises they can share with you that will help you with that. All right. And also, if you go to my YouTube channel, I have a section on VMO strengthening exercise, on strengthening those muscles to actually cause your patella to align properly. So I hope that helps you. Okay, the next question is from Mari Mar, and it says, "Hey, Dr. Levi, could you do a similar video for musicians? I'm a guitarist getting some strength, and the left hand fingers or endurance for right hand for picking would be nice." Okay, so Mari Mar, I am going to do a video. The next video I intend to do will be one for musicians, for drummers, for guitarists, for saxophonists, for flautists. That's our goal coming up. Now, I want to tell you this. As a guitarist, you can do some of the exercises that are hand, forearm, strengthening exercises for the gamers. That'll help you. But again, gaming is not the same as a musician, but some of those exercises will help you. But I will have specifically geared exercises for musicians. We will do those on our next video shoot. Our next video shoot hopefully be within the next month or so, and get ready for those. I'll have several of those videos together that will help you. And I want to thank you for your question. And again, if you go to look at you subscribe to the channel, which you've already done, I believe, but you'll see the exercise there for hand, form, strengthening exercises for gamers, but you can also use those as a musician right now. They'll help you. Okay? And make sure as a guitarist that you're icing your forearms before and after play, that you do the inertial exercise, the stretching exercise that I showed earlier. That's very, very important. All right. Now, this is Bradley. So, on Mari Mar, I hope that helped you too. So, thanks for your question. So, Bradley, when I was younger, Dr. Levi, I broke my right arm. When I make a half fist with my right hand, my little finger goes off to the right and pushes into my right finger. If I lower my pinky finger before the others, it naturally lies under my finger. Should I care about this? Okay, Bradley, you have something very common that I see in hand surgery. It's called a crossover deformity. So I want to show you what that is. If you had a fracture in your hand or forearm that wasn't properly realigned when this happened, when you make a fist like this, your small finger goes under like that. So you're unable to close your hand completely because your small finger goes under your ring finger like that. That's called a crossover deformity. So I hope you can see that really well. Now, that type of misalignment is often due to a bony problem, bony architecture problem, meaning that the bones were not properly set sometimes, and now you develop this problem. So with that said, the only way that we really treat that when necessary, if it's causing you a severe problem, would actually be to osteotomize, or to really re-break the finger basically, and to realign that. And then we put a plate inside that, or pins. It takes maybe 45 minutes to an hour, depending on how bad the crossover deformity is. But I want to share this with you. We only do that when it's really, really necessary. If you did this as a child and you're used to dealing with your hand and can function really well, I don't recommend that. And don't forget, I'm a surgeon and I love operating. But I always remind everyone that there's nothing surgery can't make worse. So you want to try to avoid that. And the other thing about surgery, I tell this to my patients all the time, that is, surgery does one of three things. It's like taking a medication. It does one of three things also: make you better, make you worse, or no change. It's always one of those three. So when you're having surgery, when you're taking a medication, you're always hoping for one of those things, but you're really hoping for make you better. But you have a 66.66% chance that it may not get better. It may be the same or possibly worse. So I don't recommend surgery for that if it's not bothering you. But if it's bothering you tremendously, if you can't function, if you're having pain, then yes, you can undergo that procedure. It can be a very difficult procedure if someone's not really well trained to do that. If you do have it done, I highly recommend that you have it done by an orthopedic hand surgeon, because that's what we do. We do hand, wrist, elbow, and shoulder all the time. That's what we really love. So I hope that helps you, Bradley. Okay, next question is from, I love this handle, from Core Slaw. I love that, C-O-R-E, Slaw. So the question is, hey, Dr. Levi, I appreciate you putting these videos up. I think I have carpal tunnel syndrome. I plan on going to a hand doctor just to make sure, but I was wondering, should I stop console gaming altogether and do these exercises that you provide in this video, along with your other videos for carpal tunnel syndrome? Or can I still game for hours on end and do these exercises? Also, should I ice before and after gaming? How long does it normally take to cure carpal tunnel syndrome? So let's talk about carpal tunnel syndrome. Carpal tunnel syndrome is the most common nerve compression issue of the upper extremity. So what carpal tunnel syndrome is, let's go over that also. So here in the wrist, this is the carpal tunnel area here. And there's a nerve that passes under the transverse carpal ligament called the median nerve. And if it's swollen, if it's inflamed, and if the transverse carpal ligament is very thickened and fibrotic and inflamed, then it can cause compression on the median nerve. Median nerve is right in this area. If you have compression on the median nerve, what are the symptoms of carpal tunnel syndrome? Well, they're the following: numbness and tingling and pain in the thumb, index finger, middle finger, and half of the ring finger. Difficulty with dexterity, lifting up coins from a table, for example. Pain that wakes you up at night. A feeling of electricity or lightning sensation going down your hand. Decreased grip strength in your hand, difficulty driving, a feeling that wakes you up at night, you have to shake out your hands. If you're driving, your hands start to feel weak. If you're at the gym lifting weights, your hands just feel weak and very, very tired. Well, if you're typing for a long period of time or working at a console, at a desk, or at a keyboard, then you may have those feelings also. So those are the basics of carpal tunnel syndrome. Now, how do we treat it? Well, we treat it with the following. One, we try anti-inflammatory medication for those who prefer that route. The other things that we do is what I prefer is wearing a splint, physical therapy, acupuncture, as well as occupational therapy sometimes. If those things don't help, then we can often tell someone to game less, to type less, to make sure that their desk is ergonomically balanced and designed so that the monitor, the keyboard, everything's at the proper level. Maybe they need a backrest, maybe need a footstool, maybe they need a tracking ball or an ergonomically designed keyboard. All of these things are important to preventing the symptoms of carpal tunnel. Now, with that said, if you're having these feelings and you think it's carpal tunnel as I've described, then the first thing I would do, yes, I would game less. So if you're gaming, as you said here, gaming for hours on end, if you're gaming for 12 to 14 hours a day like most gamers do, I would recommend that you game less, maybe 8 to 10. Ice your arms before and after. Maybe consider taking an anti-inflammatory medication if you're not allergic to one, like ibuprofen or Aleve or Advil, something that can help to break that inflammatory cascade so you'll feel slightly better. The other thing, of course, is to simply just take a break. And also do the stretches, the hand, wrist, elbow, shoulder stretches for gamers, the posture exercises. All of those will help you. You know, my team and I would do these videos really, to be quite honest with you, to be of service to the community. For gamers, for individuals who have repetitive stress injuries, for anyone who, if you have hands, wrists, shoulders, elbows, if you have a body, then our show, the Dr. Levi show, as well as our YouTube channel, is about giving you the best in current, appropriate, science-based fitness medicine. That's what I am. I'm a doctor, and also a fitness doctor. So my goal is, how do I get you healthy? How do I have you to maintain it? And then how do I have you accept fitness as a lifestyle? So if it's gaming a little bit less and doing the exercises and feeling better, well done. So our goal here is to get you to have your body in the best condition possible, 24 hours a day, 7 days a week. We want you to feel good. But more importantly, our show is about educating and empowering you so you can share this information with other people so we can keep the train and legacy of healing going forward, fitness growing for everyone. We want to really expand the consciousness of fitness for everybody. Fitness is a lifestyle. All right, so Course Law, I hope that helps you. Again, yes, I recommend that you go see a physician, orthopedic hand doctor, who's going to recommend most likely those exercises as well as an EMG nerve conduction study to see how well the nerve is compressed and if the nerve is having any issues. And more importantly, he or she will look at you to see if you have thenar atrophy. Thenar atrophy, Course Law, is this area of your hand. If you look at your hand and this part of your hand looks very, very flat, it has pits in it where it looks like a hole sitting inside the muscle here. If it doesn't feel very hard and firm when you squeeze your hand, then you may have thenar atrophy, and that is pathognomonic. Let me try to say this word one more time. Which is pathognomonic. I'm going to stop. I'm not going to say the word again. I think it's not the day for me to say that word. But let me just say this. If you have thenar atrophy, which is a very serious issue now, if you have thenar atrophy, then it's the I can't say it. The team here is really laughing, guys, so I got to stop. Which is a bad sign. It's a bad sign for carpal tunnel syndrome. So let me just say that. All right, Courslaw, you got us laughing in here. Now the next is from Jurugui, Jauregui. It's how's it going, Dr. Levi? I wanted to ask you a quick question. I don't have insurance, so if you answer it, it would be great. I was hitting the heavy boxing bag, and when I tried to hook it, I hurt my wrist, but I'm not sure if it's broken. It's been 2 weeks. I've taken inflammation pills, but I still have pain around the ball-shaped bone on the outer part of my wrist. The pain has reduced, but when I put pressure on the bone, it still hurts. What do you think? Thank you very much. So, Jaragwe, so from what you're explaining, and I hope I'm getting this from the hook, and I box also, is this is called the ulna. This is the ulnar styloid, this area over here. And this is the radius styloid is over here. So these are the two major bones of the forearm. So from what you're explaining from the hook, it sounds like you injured what's called the TFCC, the triangular fibrocartilage complex, the TFCC. You may have strained it or you may have torn the ligament there. Either way, I recommend that you see a doctor for this. I hope there's a clinic where you are. We can at least get this may be tough, but an MRI of your wrist. The MRI would let us know if there's a tear of that ligament. And if it's a strain, then you can simply let it rest and wear a splint for maybe 3 to 6 weeks, and it should feel better. You don't have to wear the splint all the time, but I wear it maybe half of the day, and that'll help you. And I do no heavy lifting, pushing, or pulling. I would not do any heavy bag workout at all. And the other thing that I would avoid is the speed bag. When you're hitting the speed bag like this, that compression is right on the side where you have the injury. So you really want to not do that also. So no speed bag and no heavy bag for a while, at least 6 weeks. But I'd also be sure to have a doctor see you before you get back. That's back to the gym hitting heavy like that. It's very, very important. The next one is from Why Troll So Much? Interesting name, huh? Dear Dr. Harrison, I'm a fanatic gamer, and I fear I may be heading towards repetitive stress injury. When I do the third exercise, extension of the wrist, I already feel a burn and near pain on my forearms. Does this mean my forearms are just weak, or does that mean there's a problem there that can or cannot be fixed somehow? Okay, well, why troll so much? Thanks for your question. You used the term, you said, I'm a fanatic gamer, and I fear that I may be heading toward RSI. So let me tell you, it's so important if you're gaming that much that be careful. Make sure that you're doing the exercises. Make sure that you're taking rest between gaming. If you're gaming 12 to 18 hours a day, you really have to cut it back to maybe 8 to 10. And then make sure you're doing the exercises every hour. Take a 5-minute break. Make sure you're icing your forearms, your hands, your wrists. Make sure you're doing the warm-up exercise that I have in the videos. All of these things will help you. But the most important thing that I can offer to you, why I troll so much, is moderation. That's the key. Fanatic gaming, when you use that term, that makes me think that you're gaming maybe 12, 18 hours a day. That's a lot. When you say that, that's why I remind everyone that gamers are amazing athletes. So often I have these major debates with other doctors who really say a lot of condescending things to me about why I take care of the gaming community. Well, I take care of the gaming community because they need my care. I take care of the gaming community because, yes, they are athletes. I, Dr. Levi Harrison, take care of the gaming community because I love gaming, I love gamers, and I think they're a community that has been very disenfranchised from the establishment, especially in healthcare, and many people feel like they don't matter. Well, gamers do matter. Gamers do count. Gamers are important, and gamers should be treated with integrity, compassion, and the best of healthcare. I believe that, and I will stand on that, period. So to the gamers that are out there, that's my take on gaming, of course, and I will not budge from my opinion about giving the best that I can to gamers, and I I'm committed to gamers, period. That's my platform. Now, so what I recommend, again, why I troll so much is moderation, icing, and doing the exercises. You subscribed already to the YouTube channel. Do those exercises. They should help you. If that pain continues, then you have to be seen by a healthcare provider. It's so important. But monitor how much you're gaming. Make sure your posture is okay when you're gaming. Okay meaning that you're sitting upright, your shoulders are square, your chin is up, that you're not crouched down. All right? The next one is from Nigel. My question, Dr. Levi, is how often should I do these per day or week as it pertains to hand, wrist, and forearm exercises video? Okay, you can really do those stretches, when you're gaming every day. They only take 5 or 10 minutes. And if you're gaming for 6 hours or 8 hours, why not do those stretches for 5 minutes every hour? It's like that. That's nothing. Think about it. There are 24 hours in a day. 24 hours in a day. 148 hours in a week. If you can't simply take 20 minutes a day to stretch, that's nothing. That's really nothing. Your body deserves that. Do it for you. All right? So, Nigel, I hope that helps you. So, yes, you can do them every day because these are not like going to the gym working out with weights. These are basic stretches and exercise that your body will appreciate. And also extend your gaming career. That's important. Now, let's go. I have some other questions. I'm so glad we'll get to everybody's question today. This is from Satbir, Satbir. Hello, sir, Dr. Levi. I'm from India, and I want help and suggestions in ankle sprains, and it's taking long to heal. Okay, so Satbir, thank you so much for your question. Ankle sprains are very, very interesting. Depending on what you didn't tell me is where the sprain is. Is it on the outside of your ankle or the inner aspect of your ankle? So let's go with a few things. Chronic ankle sprains can really be disturbing for most athletes, and it's so important that you go to physical therapy for them. It's very important that you're being examined by a doctor who he or she can look at your ankle and make sure that the alignment of your foot is fine, that you don't have a fracture there. Make sure that you have x-rays of the ankle also to make sure you don't have a fracture, of course, or that you have a small avulsion injury of a ligament. So chronic ankle sprains, I often recommend that you wrap them, that you do the exercises that your doctor, that he or she recommends, and of course physical therapy, and of course acupuncture. I love acupuncture. I think it's so effective for so many injuries. So I recommend that also, Satbir. So I hope that helps you. The next question, it's a rather lengthy one. This is from Ramin, R-A-M-I-N. Hello, Dr. Harrison. 9 months ago, I got injured by lifting a heavy object. During that time, I also went to the gym. Afterwards, my left wrist was injured. I had a break for 2 days. Then I started again, but I still had pain. I went to my doctor. He told me to rest for 14 days and start rehabilitation. I started slowly, but my wrist was still hurting. I decided to read about it on the internet. I had a break for 4 months, and I started again. During the rehab, I had been doing exercise and stretches. I've also used your hand and wrist stretch video, but still I feel something in my wrist and forearm. The attached file shows the area where I feel pain during heavy exercises. I have started at the gym again, and I only use exercises which don't hurt my wrist, but I really want to be 100% healed from the injury. What's your advice? Okay, Ramin, thanks for your question. It's a complex question now because your videos, I did not see them. I wasn't able to access or see anything that you sent with that. So you can resend them to me and I'll look at them. But from what you said, if you're having wrist and forearm pain, the number one thing that I recommend, again, is modify your workout. It's like the old joke of that if you say something hurts and you tell people, well, don't do that if it hurts. So it's the same for you. If it hurts, then I recommend you not do it. But more importantly, go to a doctor if you have access to one. I hope you do, for appropriate care and to be seen and evaluated. And also, I would say this is if you're doing the exercises and you feel that you're in the gym lifting heavy weight, then maybe try doing those exercises with lighter weight or with no weight at all. Or maybe take a break from doing weighted exercises for maybe a month or two and just do a lot of core exercises, do a lot of aerobics, and see if it gives your body a chance to heal itself. And then start off slowly. The goal when you're in rehab is, I tell us to all the professional athletes I take care of, all these celebrities and my even next door neighbors, you have to go slow, everything in moderation. So Raman, I hope that helps you. The next one is from Kathy Hurtle. I have calcification in my shoulder. I just had a cortisone injection. I'm supposed to do rotator cuff exercises. My concern is my back went out a few years ago. It seems like my lower back hurts after these exercises. Am I possibly doing them wrong? Would it help to sit while I do them? Thank you, Dr. Levi. So, Kathy Hurtel, I recommend the following. Number one, yes, do the exercises when you're sitting down. That may help you a lot. Make sure that your back is against the chair and your shoulders are up, that your head is up. Everything, again, as I've said before here today, postural alignment is so important. How you sit, how you stand, it's just very, very important that you're aware of that. You know, for myself, whenever I sit in the chair, I'm always aware that my back is straight. I'm always aware that my shoulders are square, meaning, again, you're not hunched over, you're not bending, looking down like that your back is up. You know, one thing I love, I treated several dancers here in Los Angeles, and I love when I'm talking to them because often when they're in my office, their alignment is so extraordinarily and so beautiful. Their lines are so long. It's great to see them because you know that they're aware of their bodies, the way they walk, the way they move. They're just amazing athletes also. So yes, Kathy Hurtel, I recommend that you do the exercises sitting down, but more importantly, let your doctor know that when you do these exercises, you're still being bothered. You still have pain. That's important. And depending on how big the calcification is in your shoulder, you may consider having that arthroscopically removed if it continues to bother you or give you impingement syndrome. All right? Our last question, I'm glad we made it, is from David. It says, Dr. Levi, I've been to an orthopedist and have been diagnosed already. I was wondering if you think I should try to do wrist exercise and stretching to help my ligaments in my wrist to heal, or should I rest the wrist completely and then start exercising the wrist once the ligaments show signs of no pain? Okay, so David, I appreciate the question, but you said you were diagnosed, but I don't know what you were diagnosed with. I don't know what the problem was. So let me say this. If you were diagnosed with repetitive stress injury, RSI, then moderation will be the key. And icing your wrist, resting your wrist, doing the exercises, but more importantly, having an open dialogue with your doctor and asking her or him, what's the next move if you're not feeling things are beneficial for you. It's so important that you go to a doctor who is not dismissive, that they respect you, that they're listening to you, that they're spending some time with you to get to know you and know what your lifestyle is. So if you're a gamer, if you're an athlete, if you're a blogger doing a lot of texting, typing, writing, we have to know those things so we can give you exercises that can be done to prevent further injury. That's so important. So, David, again, I'm not sure what you were diagnosed with, but if your ligaments in your wrist and hand are bothering you, then it's so important that you talk to your doctor and do some of the exercises that I've suggested, but show your doctor those exercises so that he or she will be on board with them, all right? So, all right, everybody, this is Dr. Levi with your question and answers today, and me trying to say pathognomonic. That was the word. Now, ask me how to spell that, then we really got a problem. So today, of course, is March 23rd, 2016. I want to say happy birthday to a good friend of mine, Roxanne. She's over at a place in Glendale where I love a lot. I want to say happy birthday to her. And also, last week, the 27th, was Blake Griffin's 27th birthday. Also, I'm a big Clippers fan, so send us tickets. I'm just kidding. I can buy my own tickets. So I want to say, Blake, happy belated birthday to you. And to one of my patients, Victoria. I apologize I didn't get a chance to say that last week because I told her I would definitely mention it. And last week we were so blown away with the frog team that was here that I just didn't get a chance to. So Victoria, thanks for all your birthday gifts, and I'm getting that card framed. Victoria is an artist, and she's someone I take care of, and she's just an amazing woman, a great patient, and a really wonderful person. Well, this is Dr. Levi. I'll see everyone back next week. Remember, be kind to the veterans. They're the true heroes of America, those men and women. And again, our hearts and prayers go out to the people in Brussels, Belgium, and we know that everything will be okay. So take care, everybody, and I hope everything helps you keep on exercising. Exercise is life.